That weak stream is not normal aging. I want you to sit with that sentence for a second because I know exactly what you've been telling yourself. You stood at that toilet this morning, maybe last night, maybe every morning for the past 2 years, and you watched the water trickle out. You pushed a little. You waited. You felt that vague, nagging sense that you weren't quite done, like something was still left behind. And then you zipped up and walked away. You didn't mention it to your wife. You didn't bring it up at your last physical. Because honestly, what would you even say? You're 50-something. This is just what happens, right? I'm going to stop you right there. That feeling, that incomplete, half-finished, weak, and then it stops sensation, is not a footnote in the story of normal aging. It is a flashing red warning signal that something very specific is happening inside your prostate right now. And the fact that you're brushing it off, the fact that literally millions of men are brushing it off every single day, is exactly why prostate disease in men over 50 has become one of the most undertreated health crises in this country today. I've been in functional medicine for over 22 years. I've seen men walk into my office who waited 3 years, 5 years, sometimes longer before addressing this one symptom. And I want to be direct with you today. The consequences of ignoring this go far beyond uncomfortable bathroom trips. The downstream effects, and I mean that both literally and medically, reach well beyond your prostate in ways that will genuinely surprise you. I'll explain exactly what those downstream effects are in a moment. There's also a specific biological cascade unfolding inside your body right now that explains why this symptom appears when it does, why it progressively worsens if left unaddressed, and why the advice most men receive from their primary care physician barely touches the surface of what's actually going on. Stay with me, because what I'm going to share with you today changes everything about how you understand this, and more importantly, what you can do about it starting right now. Let me start by giving this symptom its proper clinical name, because part of the reason men ignore it is because nobody has ever explained it to them in a way that communicates the weight of what it actually means. What you're experiencing is called post-void residual sensation combined with reduced urinary flow rate, also known as lower urinary tract symptoms secondary to bladder outlet obstruction. A urologist might measure your flow rate with a uroflow test, a simple device that precisely tracks how many milliliters per second your urine passes through. A healthy man in his 30s produces a peak flow rate of around 25 milliliters per second. By the time most men in their 50s finally come to see me, that number has quietly dropped to 12, sometimes 10, sometimes lower. And they had absolutely no idea. They'd simply written themselves off as a slow urinator and moved on with their lives. What's actually happening inside your body is this. Your prostate gland wraps around your urethra the way a donut wraps around a straw. When that gland enlarges, and by age 50, 50% of men already have measurable prostate enlargement, a number that climbs to 90% by age 80, according to data from the American Urological Association. It begins squeezing that straw. The urethra narrows. The flow slows. You push harder. Your bladder, being the adaptive organ it is, responds by building thicker, stronger muscle walls to generate the pressure needed to overcome the obstruction. On the surface, it looks like your body is coping just fine. But there is a much darker side to that compensation that most men never hear about. The primary driver of this prostate enlargement is a hormone called dihydrotestosterone, DHT. Your body converts testosterone into DHT through an enzyme called 5-alpha reductase, and as you age, the activity of that enzyme increases. DHT levels rise. DHT has an extraordinarily potent growth-stimulating effect on prostate cells. It binds to androgen receptors in the glandular tissue and essentially tells those cells to keep multiplying. But it's not just about size. DHT also triggers the release of inflammatory cytokines. These are small chemical signaling molecules that create a state of chronic, low-grade inflammation throughout the prostate tissue. That inflammation makes the gland stiffer, more congested, harder to drain. And critically, what your doctor probably didn't explain to you is that the same inflammatory environment is activating the smooth muscles that surround the bladder neck and the prostatic urethra, creating a state of constant muscular tension, a biological traffic jam. That's why you stand there, breathing, pushing, and very little happens. It is not weakness. It's not laziness. It is your own biology working against you through a mechanism that is entirely addressable if you catch it in time. The part that genuinely concerns me most is what happens to the men who don't catch it. The bladder is a remarkable compensatory organ, right up until the point it can no longer compensate. When it works overtime against obstruction for months and years, the condition clinicians call detrusor muscle hypertrophy develops. The bladder wall thickens. It gradually loses its elasticity. Its capacity shrinks. It becomes irritable and hyperactive. Suddenly, you're not just dealing with a weak stream in the morning. You're waking up 2, 3, 4 times every single night. You're having urgency episodes you can't control in the middle of a meeting, in a car, at a restaurant. Your sleep is destroyed. Your confidence is shaken. Your world quietly begins to shrink around the geography of the nearest bathroom. I remember a patient I'll call Robert, 58 years old, construction manager, built like a tank. The kind of man who never called in sick, never complained about anything, prided himself on handling whatever came at him. He didn't come to my office because of his stream. He came in because on a Saturday morning, he literally could not urinate at all. Acute urinary retention, complete blockage. He'd been ignoring that weak stream, that nagging sense of incomplete emptying, for 3 full years. And he looked at me across my desk with this expression I'll never forget. Embarrassment, fear, and a kind of exhausted disbelief. And he said, quietly, "I thought I was just getting old, Doc." He ended up needing emergency catheterization that same day. That look on that man's face is exactly the outcome I'm trying to help you avoid. So why do I approach this so differently from most physicians? My name is Dr. Michael Stone. I've been practicing functional medicine for over 22 years, and for the last 15 of those years, men's prostate and urological health has been one of my primary areas of specialization. I've worked collaboratively with urologists, reviewed extensive clinical literature from institutions including the NIH, the Cleveland Clinic, and the Harvard T.H. Chan School of Public Health. And I've helped hundreds of men navigate this exact issue, from early-stage functional changes to post-surgical recovery. But my perspective on this isn't purely clinical. I came to this area of medicine partly because of my own father. He was diagnosed with advanced benign prostatic hyperplasia, BPH, at 63. The thing is, he'd been having symptoms since his late 40s. He knew something wasn't quite right. He just didn't talk about it. He was from that generation of men for whom going to the doctor felt like admitting defeat, like surrendering something essential about what it meant to be a man. By the time he was properly evaluated and the full picture was clear, his bladder had been under strain for well over a decade, and the road forward was considerably harder than it needed to be. I watched my father navigate the loss of his sleep, the constant low-level anxiety about being too far from a bathroom, the way it gradually changed his personality and his presence in the world. That experience is woven into every patient conversation I have about this subject. The conventional medical approach to BPH and early prostate dysfunction isn't wrong. It's incomplete. A urologist might appropriately prescribe an alpha blocker like tamsulosin to reduce smooth muscle tension, or a pharmaceutical 5-alpha reductase inhibitor like finasteride to suppress DHT. These are legitimate interventions, but they don't address the underlying inflammatory environment, the metabolic drivers, or the lifestyle factors that are continuously feeding this process from the inside. And they carry a side effect profile: sexual dysfunction, retrograde ejaculation, orthostatic dizziness, fatigue, that many men quietly suffer through, or that causes them to quietly abandon treatment altogether. A 2021 review in the Journal of Urology found that nearly 40% of men prescribed pharmaceutical BPH therapy discontinue it within the first year, most commonly due to side effects. 40%. That is not a treatment success story. That is a gap, and that gap is precisely where integrative functional medicine operates. So if pharmaceuticals alone aren't the complete answer, what is? Let me walk you through what the functional medicine framework actually looks like for this specific problem, step by step, with the mechanism behind each piece. And I want to be unambiguous. I am not anti-medication. If you need medication, you take it. What I'm offering you here is the biological understanding and the evidence-based natural tools that can work alongside conventional treatment, or, depending on where you are in this process, in some cases preceding it. The first thing to understand is what I call the DHT inflammation feedback loop, and why interrupting it from one direction alone doesn't work. DHT drives prostate cell proliferation, as we discussed. But DHT simultaneously recruits inflammatory immune cells, specifically macrophages and mast cells, into the prostate tissue. Those cells release compounds called prostaglandins and interleukins that create and sustain the local inflammatory environment. Here's the critical part. Those same inflammatory compounds then turn around and upregulate 5-alpha reductase activity, the very enzyme that produces more DHT. So DHT generates inflammation. Inflammation generates more DHT. It is a self-reinforcing closed loop, and once you are inside it, addressing only one arm of the cycle produces limited temporary results. That's why so many men take a single supplement for a few weeks, notice modest improvement, decide it's not working, and quit. The natural compound with the most robust evidence for interrupting this loop is beta-sitosterol, a plant sterol found in highest concentrations in saw palmetto berries, pumpkin seeds, and Pygeum africanum bark. A 2019 Cochrane review, and Cochrane reviews represent about the highest standard of evidence available in medicine, confirmed that standardized saw palmetto extract significantly improved urinary flow rates and reduced international prostate symptom scores in men with BPH, with a safety profile substantially superior to pharmaceutical 5-alpha reductase inhibitors. The critical word there is standardized. You want an extract standardized to a minimum of 85% fatty acids and sterols. The generic saw palmetto capsules on the shelf at most drugstores do not meet that threshold. That difference in quality is not trivial. It's the difference between a clinically active dose and an expensive placebo. The second arm of the protocol addresses the inflammatory environment directly. The compound that consistently surprises physicians when I present the data on it is quercetin, a flavonoid found naturally in red onions, capers, apple skins, and green tea. A study published in the British Journal of Nutrition found that daily quercetin supplementation reduced systemic inflammatory markers and specifically lowered PSA levels in men with chronic prostatitis. The clinical dose is 500 milligrams twice daily, and it should be paired with at least 2 grams of combined EPA and DHA from a quality fish oil source daily. That omega-3 combination shifts the eicosanoid balance in the prostate, essentially changing the chemical language your immune cells are using inside that gland, from inflammatory to anti-inflammatory. Think of it as turning down the volume on a chronic alarm that has been ringing for years. I promised you earlier there is a third factor that most people completely overlook, and here it is: zinc. Your prostate gland, under normal healthy conditions, has the highest zinc concentration of any soft tissue in the entire human body. Zinc is not incidental to prostate function. It is central to it. Zinc regulates DHT activity at the cellular level. It's essential for prostate epithelial cell metabolism. It helps maintain the integrity of the glandular architecture. But chronic stress, poor dietary quality, excessive alcohol consumption, and, this is something most men have no idea about, certain very common medications including diuretics, proton pump inhibitors, and ACE inhibitors all deplete zinc at an accelerated rate. A 2022 study supported by the NIH found that men with diagnosed BPH had significantly lower prostate zinc concentrations compared to men with normal prostate volume. When zinc is chronically depleted, the prostate loses one of its primary internal regulatory mechanisms. The recommended dose is 15 to 30 milligrams daily in the form of zinc picolinate or zinc glycinate, both of which have superior bioavailability compared to the more common zinc oxide found in basic multivitamins. The fourth component, and this is the one that tends to produce the fastest noticeable results for my patients, targets the smooth muscle component directly. Your bladder neck and the smooth muscle of the prostatic urethra are innervated by the sympathetic nervous system through alpha-adrenergic receptors. When you are chronically stressed, and I'll be honest with you, most men over 50 who are managing careers, finances, families, and aging parents are living in a state of sustained, low-grade sympathetic activation. That smooth muscle is chronically contracted. Magnesium glycinate at 300 to 400 milligrams taken at night is a natural smooth muscle relaxant that directly reduces that baseline tension in the bladder neck and urethral smooth muscle. Most of my patients notice a meaningful improvement in their flow within 2 to 3 weeks of adding this to their routine, often before the structural prostate changes have had time to develop. This is the point in the conversation where I want to mention something I've been recommending to patients over the past year. Getting this kind of multi-component protocol right, the right doses, the right timing, the right combination, and knowing whether it's actually working, requires consistent daily tracking. One of the tools I now actively use with many of my patients is an app called the Tomato app. It's built specifically for this kind of structured daily health tracking and protocol adherence. I'll leave the link in the pinned comment below if you'd like to take a look at it. It has been genuinely valuable in helping my patients maintain consistency, which turns out to be one of the single strongest predictors of who achieves real results with this protocol and who doesn't. And that word, consistency, is the non-negotiable foundation of this entire approach. These compounds operate through cumulative biological mechanisms. They are not like an antibiotic where you take a pill and the bacteria are dead in 48 hours. Beta-sitosterol, quercetin, zinc, magnesium, their effects build progressively over 8 to 12 weeks of uninterrupted, consistent use. The conversation I have with every single patient who starts this protocol is the same. You are committing to 90 days. You are tracking your nighttime bathroom trips, your perceived flow strength on a 1 to 10 scale, and your sense of complete emptying every single week. The men who do that diligently are the men who get better. Not because tracking is some kind of magic, but because tracking keeps you consistent, and it lets you see your progress in real time, rather than relying on a vague, subjective sense of whether things are changing. The evidence behind this integrative approach is not fringe science. A 2023 meta-analysis published in the journal Urology and Nephrology reviewed 14 independent randomized controlled trials examining combinations of natural compounds for BPH management. The finding? Combinations of saw palmetto, zinc, and beta-sitosterol produced statistically significant improvements in International Prostate Symptom Score, the standard clinical instrument for measuring BPH severity, that were comparable to outcomes with the pharmaceutical drug tamsulosin over a 12-month follow-up period. The critical difference? The natural compound group showed no significant incidence of sexual side effects, which were reported at measurable rates in the pharmaceutical group. That is 14 independent trials, not a supplement company's marketing brochure. That is peer-reviewed evidence. But clinical data without a human face is just numbers on a page. Thomas was 63 years old, a retired school teacher, a quiet, thoughtful man who came to me not entirely of his own initiative. His wife noticed that his morning bathroom routine was taking an unusually long time and made the appointment herself. Thomas arrived a little resistant, a little embarrassed, certain this was simply one of those things that came with age and that there wasn't much to be done. His PSA came in at 4.2, elevated but not alarmingly so. His Euroflow test revealed a peak flow rate of 9.1 milliliters per second, substantially below the normal range. His International Prostate Symptom Score was 18 out of a possible 35, placing him solidly in the moderate to severe range for BPH symptom burden. The good news, and this was important, was that we caught Thomas before his bladder had developed significant secondary compensatory changes. The window was still open. We implemented the full functional protocol. Standardized saw palmetto extract at 320 milligrams twice daily, quercetin at 500 milligrams twice daily, zinc picolinate at 20 milligrams daily, magnesium glycinate at 400 milligrams every evening, combined EPA and DHA at 2 grams daily, and targeted dietary modifications. At the 90-day reassessment, Thomas's peak flow rate had improved from 9.1 to 14.6 milliliters per second. His symptom score dropped from 18 down to 9, moving him from the moderate to severe category into the mild range. He was sleeping through the night for the first time in what he estimated was 3 or 4 years. And when his wife came in with him for that follow-up appointment, she said to me, completely unprompted, that he seemed like a different man. She wasn't talking about his PSA. She was talking about his mood, his presence, his energy level in the house. Sleep deprivation does profound things to a person's personality, their patience, their sense of self. Restoring someone's sleep is not a small intervention. It touches everything. Let me address the objection I hear most frequently, because it is genuinely dangerous if left unchallenged. My PSA is normal, so I'm probably fine, right? This is one of the most widespread and potentially harmful misunderstandings in men's health, and I want to be as clear as I possibly can. A normal PSA does not mean your prostate is healthy. PSA, prostate-specific antigen, is primarily a useful screening marker for prostate cancer risk. It is not a reliable functional indicator of obstructive, inflammatory prostate dysfunction. You can have a perfectly normal PSA and simultaneously have a significantly enlarged prostate, substantially reduced urinary flow, chronic prostate inflammation, and meaningful downstream risk to your bladder and kidneys. PSA measures one specific biological variable. It does not measure your flow rate. It does not measure your residual urine volume. It does not measure your symptom burden. A normal PSA is good news, but it is not a clean bill of prostate health. Do not let it be the reason you don't investigate further. There is one more thing I need to warn you about because I have watched it derail progress for more patients than I'd like to count. I call it the plateau trap. A man starts this protocol. He feels meaningfully better in weeks 3 or 4. His flow is stronger, the urgency is reduced, he's sleeping better. So he starts skipping days. He reduces his doses. He gets less vigilant. And then, over the following weeks, things gradually slide back. He concludes that the protocol stopped working. What actually happened is that the protocol worked exactly as it should, and he abandoned it at precisely the wrong moment, before the deeper structural changes in the gland had time to consolidate. The improvement in smooth muscle tension and inflammatory signaling happens relatively quickly in those first 4 to 6 weeks. The actual structural changes, the reduction in glandular volume, the normalization of the tissue architecture, the restoration of adequate zinc concentrations in the prostate cells, those take the full 90 to 120 days of uninterrupted consistency to become durable. Feeling better is not the finish line. Feeling better is the halfway point. I promised you at the beginning of this video that I would explain exactly what I meant by the downstream effects that go beyond the prostate, the consequences that extend further than most men realize. Let me close that loop now because it is the part of this conversation that I consider genuinely urgent. When your bladder compensates against obstruction for an extended period, the elevated intravesical pressure, the pressure building up inside the bladder, does not simply stay contained within the bladder wall. Over time, that pressure can be transmitted backward through the ureters toward the kidneys, a process called vesico-ureteral reflux. Prolonged, untreated bladder outlet obstruction is a documented and well-established cause of bilateral hydronephrosis, pathological swelling of the kidneys, and a contributing factor to chronic kidney disease. A 2020 study from the Cleveland Clinic found that men with untreated severe BPH had a 23% higher incidence of chronic kidney disease over a 10-year follow-up period compared to men who received appropriate treatment. The weak stream you are brushing off is connected, through a clear and measurable biological chain, to the long-term function of your kidneys. That is not a scare tactic. That is the anatomy. So let me give you 3 concrete things you can do beginning tomorrow. Not eventually, not when you get around to it, tomorrow. The first one is as simple as a handful of seeds. Add 30 grams of raw pumpkin seeds to your morning routine. That is roughly a small cupped palmful. Pumpkin seeds are one of the most bioavailable natural sources of both beta-sitosterol and zinc simultaneously. A 2014 study published in Nutrition Research and Practice followed men with BPH through 12 weeks of daily pumpkin seed consumption and found a statistically significant improvement in their symptom scores compared to placebo. The word raw matters here. Roasting degrades the active sterols that deliver the benefit. This is not a dramatic lifestyle overhaul. It is 30 grams of seeds in the morning. You can add them to yogurt, to oatmeal, eat them plain. Start tomorrow. The second one applies specifically to men who spend extended hours sitting, at a desk, in a car, in meetings. Prolonged sitting compresses the pelvic floor, elevates perineal pressure, reduces circulation to the prostate, and raises local tissue temperature, all of which amplify inflammation and worsen pelvic congestion. Set a recurring timer for every 45 minutes during your workday. When it goes off, stand up, walk for 2 minutes, and perform 10 slow pelvic tilts, a gentle anterior-posterior rocking of the pelvis while standing upright. Total time investment, 3 minutes. Over the cumulative hours of a work week, those micro-movement breaks create a measurable reduction in pelvic congestion. Small habit, real biology. The third one is perhaps the most empowering. Change how you show up at your next medical appointment. Most men go to their annual physical, accept a PSA test, get told their number is fine, and leave feeling reassured. Don't do that anymore. Walk in and ask specifically for 3 things. A uroflow test to measure your peak urinary flow rate, a post-void residual ultrasound to measure how much urine remains in your bladder after you urinate, and a formal symptom assessment using the validated International Prostate Symptom Score questionnaire. These are not exotic specialty tests. They are standard urological assessments that are entirely appropriate for any man over 50 with any urinary symptoms. The reason many doctors don't automatically order them is a simple, unfortunate assumption that men won't want to talk about it. Prove that assumption wrong. 4 months after that acute retention episode, Robert came back into my office. He was on a carefully modified version of the functional protocol, running in parallel with the medical management his urologist had appropriately prescribed. His uroflow numbers had improved substantially. He was sleeping a solid 4 to 5 hours before his first bathroom trip of the night, instead of waking up every 90 minutes like clockwork. He sat down across from me and he said something I've carried with me ever since. He said, "Doc, I had 3 years of warnings and I talked myself out of every single one of them. I kept thinking if I just left it alone long enough, it would work itself out. I hear some version of that sentence in my office more often than I can count. It is not a character flaw. It is not stupidity. It is how men are wired when it comes to their own bodies, built to push through, built to minimize, conditioned to believe that acknowledging a problem is the same as admitting defeat. But your prostate does not operate on those terms. The biology unfolds on its own schedule, indifferent to your stoicism, indifferent to how busy you are, indifferent to the story you're telling yourself about what's normal for your age. The warning sign is real. The cascade is real. And the good news, the genuinely good news, is that if you're watching this video, you likely still have time to address this in a way that matters. If this conversation gave you something useful, a clearer picture of what's happening inside your body, language for symptoms you didn't have words for, a protocol and a direction to move in, then I'd genuinely love for you to subscribe to this channel. Every week I share new research, new clinical protocols, and evidence-based perspectives on men's health drawn from both conventional medicine and the functional approach. The kind of information that should be in every man's hands and often isn't. And one final thing before you go. The Tomato app I mentioned, the tracking tool I use with my patients to support this kind of protocol work, that link is sitting right there in the pinned comment below this video. Take a look at it when you have a moment. The stream doesn't lie. It never has. Start listening to it today.